Hello. I am Dr. Mizunaka of Longevity Japan. This channel will explain a variety of topics each time with a medical theme. Please subscribe to the channel. Many people often hear the name diabetes but do not really know much about it. In this video, we will give you an overview of diabetes. Please watch it to the end to deepen your understanding of diabetes. What is diabetes? Sounds very difficult, doesn't it? Diabetes is a chronic condition of high blood sugar caused by a deficiency or reduced action of insulin, a hormone that lowers blood sugar. You may be thinking, what? That's it? Many of you may be thinking. That's the principle. First, remember that sugar and insulin are related. Insulin is a hormone secreted by the pancreas in the body that lowers blood glucose and plays a very important role in controlling blood glucose levels. In fact, there are many hormones that raise blood glucose levels, such as glucagon, thyroid hormone, growth hormone, and adrenal cortical hormone, but insulin is the only hormone that lowers blood glucose. Why is insulin the only hormone that can lower blood glucose? It is said that this is due to the fact that the history of mankind has been a long-term struggle against starvation. Because there were few situations in which blood glucose levels rose too high, as is the case today, the need for blood glucose-lowering hormones was probably low. Insulin is full of human history. Insulin is constantly secreted by our body 24 hours a day, without a break. The insulin that is secreted 24 hours a day is the basal secretion, shown in green, and the insulin that is secreted when we eat is the additional secretion, shown in orange. The effects of insulin also vary from person to person. Visceral fat stores energy in preparation for starvation, but it also releases beneficial cytokines called adipocytokines. However, as obesity progresses and visceral fat increases too much, the balance of adipocytokines is disturbed and insulin becomes less effective. The pancreas responds to such insulin resistance by working harder to increase the amount of insulin. However, if the pancreas is unable to bear the burden for a long period of time and becomes tired, insulin secretion decreases and the pancreas is unable to respond to insulin resistance. This is how diabetes occurs. For most people, the first cause of diabetes is obesity. The number of people with diabetes is rising at a tremendous rate worldwide. In 2000, there were 150 million people worldwide with diabetes, but in the past 20 years, the number of diabetics has increased 3.6-fold, reaching 537 million by 2020. The prevalence of diabetes has reached 10.5%, with 1 in 10 adults suffering from diabetes. Almost half, 44.7%, of these people are said to have undiagnosed diabetes. It is estimated that 1 person dies from diabetes every 5 seconds worldwide. It is very important to know about diabetes because there are various treatments for diabetes today. There are 2 main types of diabetes, type 1 and type 2. Let's review the differences in the table. Type 1 is caused by one's own immune system and occurs mainly in children. Type 2 is the result of lifestyle habits and most people fall into this type. Type 1 progresses rapidly, while type 2 progresses slowly. In type 1, the pancreas itself is destroyed, so insulin secretion is almost impossible, while in type 2, depending on the condition, secretion is relatively possible in most cases. Type 1 patients must self-inject insulin, while type 2 patients can use oral medications depending on their ability to secrete insulin. Type 2 is the most common type, accounting for 90 to 95% of all patients. Type 1 patients account for 5 to 10%. Why is diabetes so scary? Why is it getting so much attention? Here are some of the precautions you should take with diabetes. When high blood sugar levels persist for long periods of time, sugar becomes an oxidant in the body, causing atherosclerosis and tissue damage. The capillary vessels are then affected, especially the small blood vessels. Organs in the body with many small blood vessels are nerves, eyes, and kidneys. This is why peripheral neuropathy, diabetic retinopathy, and diabetic nephropathy are the 3 major complications of diabetes. The scary thing about these complications is that they progress slowly and unnoticed until you are aware of the symptoms. The heart is one of the organs that can be affected by atherosclerosis due to diabetes. The coronary arteries that supply oxygen and nutrients to the heart can become blocked due to arteriosclerosis, causing myocardial infarction. Myocardial infarction can be a life-threatening condition. In addition, high blood glucose levels are rich in nutrients for bacteria, while the immune cells are exhausted by the high blood glucose levels, making it difficult for the immune system to function. This makes diabetic patients more vulnerable to infection. Peripheral neuropathy makes it difficult to feel pain, which can unknowingly lead to bacterial infection from a wound in the foot. Diabetic nephropathy is also the most common reason for hemodialysis. It is important to treat diabetes early to stop complications. When I hear about complications, it makes me very scared. There is no need to panic. There are a variety of effective treatments available. I will explain them in another video. How do you like it? In this issue, we have explained basic information about diabetes. Early detection and early treatment of diabetes are important. Longevity Japan helps people from overseas to receive medical care in Japan. We offer a variety of options such as medical checkups for early detection of diabetes and regenerative medicine that can improve the function of the pancreas. At Longevity Japan, we offer medical tourism to Japan. We focus not only on medical checkups but also on regenerative medicine. Please contact us for more information. Our doctors will create the perfect plan for you.